on the same side that you're standing. You're going to come in, and the first thing is you're going to let them know, hey, I'm going to palpate the inside of your mouth with my finger. Is that okay, right? Okay. And so they're going to rest there, and you don't want them to open their mouth as wide as they can. You just need them to, you just let them know, hey, just gently open your mouth and let it rest. That's all they need to do, okay? So theoretically, this is when you're going to come in and do your intraoral observations as well. So you can kind of come in, open. You can pull the cheek out of the way, and that's where you can look at the edges of the tongue and see, okay, is there any scalloping? You can look at the gums, see if there's any retraction of the gums, any redness, any abscesses, any things like that. And then when you go to palpate, as you're reaching in towards the back of the mouth, always kind of keep your finger pointed laterally towards the outside. Don't gag them. All right? So you're in here. So I'm going to kind of, if you have the the cheek in your hand here, and you're starting to go posteriorly, you'll run across the muscle. Go just on the inside of that muscle, and then you can feel the masseter running up and down there. And so you can come all the way up under the zygomatic arch with your finger. So let's start up there with the attachments. And you're really palpating. I mean, you're getting up under, like you're trying to get up towards the eye. You're really getting up under there. Like we said before, oftentimes that's a place where you're going to find a lot of tenderness. You might find these little nodules, like trigger points under there. Periodically, especially if we're palpating deeper, you might pull your finger out and let them swallow, so that they're kind of getting a buildup of saliva in there, which is a nice, comfortable thing to do. Okay, I'm going to come back in. And so we palpate the deep masseter. If we started out into the zygomatic arch, trace it all the way down. You can kind of feel it attached down into the lower part of the mandible. If you go straight to the very posterior part of the mouth, still on the outside of the teeth, but to the very posterior part of the mouth, that's where you start to feel where that tendon from the, and so your posterior part of the mouth and then up under the zygomatic arch, that's where the tendon from the temporalis will come down and attach. And there's a little tendinous slip that will actually travel down the anterior of the ramus in some people and go under the tooth. And so you're looking for just any like tenderness up under there. You can't really tell about the turgor of the temporalis at that point, but you can see, hey, is there tenderness? I'm not really pushing on the masseter so much, which is more lateral. I'm more posterior on the temporalis. Okay? And then the last piece is you're going to trace down to where the back molars are close together. You're going to go just behind. These are the back molars, and her mouth opens on this side. I'm going to reach around behind those back molars, right in between them, and palpate. And that's where the medial pterygoid is. So I'm going to come in. I'm between her molars. I'm going to keep my finger, as lateral as I can because I don't want to gag her. But I'm going to reach. Once I get to the back, I'm going to reach just a little bit medial and kind of reach around the back of the gums there and feel that medial pterygoid. And again, you're only palpating a little part of it, but kind of push in on it. See if there's what the turgor feels like. It should be